Okay, at 6 o'clock, we're going to go ahead and get started. Today, we're going to talk about the things that were in Chapter 10 of his Buford, and we're going to begin by discussing some of the employment issues that you might face as a nurse practitioner. And on all of these PowerPoints, there are notes. I won't be able to see them tonight because I'm only using one computer. But be sure and pay attention to any notes that are on any of these slides. So if you're employed by somebody else, it has its advantages. One thing is that if you have a need for a collaborative agreement, which some states do and others don't, then this is built into a place where you're employed usually. There's no struggles for reimbursement from third-party payers either, because if you running your own office, they're reluctant or they balk to pay nurse practitioners, but not as much as if they were paying physicians, of course. And then as not an owner of an office, you have no responsibility or limited responsibility for what goes on from day to day. So when you leave the office, you actually do leave the office. If you were the owner of the office, you wouldn't be able to do that. It would be a 24/7 operation. The disadvantages to being employed by someone else, of course, is that you may be told how to practice, and you may not agree with that, and so your employer would make those decisions, so you wouldn't sometimes have a voice in that. And you could be fired or laid off by that person, whereas if you owned your own office, that's not going to happen to you. You will get a salary, but you may not be able to share in any of the profits. The rights an employed nurse practitioner has. If you're an at-will employee, this means that employment continues at the will of both parties. So either your employer or you could decide to disengage. In other words, you can be terminated for any reason at any time, or no reason at any time. Unless the nurse practitioner has a contract for a specific time of employment, an employee has no legal rights to a job. In Tennessee, I believe, is a at-will employment state. Not all states are like that. An employee may also end employment. It works both ways, barring that there's a contract that they're supposed to work for a specified time. The only protections an employee has is that they cannot be terminated solely on the basis of age, national origin, gender, race, religion, or disability. If an MP has no contract, then they must negotiate the terms of the employment on a piecemeal basis. Employment by contract, the employee and the employer agree on the terms and conditions of their working relationship. These can be complex and lengthy, and they can require careful analysis of the contract. If you are offered a contract, you should read every line in that contract and see if there's some lines that you don't agree with. Now, what can be addressed in a contract? A lot of things can be addressed in a contract, and everything is, for the most part, negotiable. So the scope of your practice could be in there if you're going to be under a physician or work beside a physician, your compensation, and unfortunately, a lot of times when you're employed initially, you will keep that range of salary the whole time of your employment, and it's possible that new employees will be paid more as they come on board. The duration of the employment, how long the contract's for, how you can alter it or update it, Who's responsible for maintaining your credentials? What's the terms of on-call responsibilities and your benefits? Your time off and expenses for continuing education. Some employers will pay that. Your vacation time, the number of office hours per week would be in your contract. Any restriction on competition, which we'll talk a little bit more about. Bonuses, reasons for termination, and assistance with continuing education. So if these give you an example of what might be in a contract, here's some other ones. How much support service is going to be offered to you? I know I just got through going to my intensives for my psych nurse practitioner DNP program, and one of my classmates was the only nurse practitioner in the community mental health center, and she had to write the letters, make the follow-up calls and everything. She had virtually no support services, so she was doing the whole thing and was getting pretty overwhelmed doing it. So you need to know who's going to be helping you. Expectations regarding the number of patients you're supposed to see a day. It may be more than you would be willing to safely see in a day. Also, regarding any non-clinical administrative work that you have to do. What is it that they're going to require you to do paper-wise? Are you going to have to monitor infections? What is it that you're going to have to do besides just your practice? Listing, are they going to list you on the door, in directories, and in advertisements? Are you going to be out on the sign? Most of these things are negotiable. I'm going to use your name when the office telephone is answered. Dial 1 for Dr. Jones, dial 2 for such and such nurse practitioner. Are there on-call responsibilities? And when you have on-call, who's going to be your backup if you have a question and need to consult a physician? A release to the nurse practitioner. The nurse practitioner's quality performance is measured by health plan auditors. You ought to have the right to see what the audits on you show, so that you can improve your practice. Who's with me? Is that Martha?
Yes, it is.
Oh, hi, Martha.
Hi, how are you, Dr. Mars?
So do you need to come? How are you?
I'm doing good.
You all right?
Yes.
I'm good. So we're going through Chapter 10 today.
Okay.
Negotiations. And there's a lot of good YouTube videos in your course. This is just over the chapter, but there's a lot of extra stuff that I found for you guys. So check those out, because I think they'll be helpful to you. So do you need a contract? Well, the good news about contracts is that it forces people to discuss issues that are in those contracts, so you get those off the table. Contracts are a record of the agreement that you've reached. A long time ago, people used to make deals for employment and otherwise on a handshake. And so it required people's memories to be intact to remember what they had promised that they would do. A contract is a written document, a legal document, and so it will record it and not have to rely on memories about the details. In most cases, an employment agreement is protective of both the employer and the employee, because it spells out what each party expects of the other. For an employee, if you had a contract that said you were going to be employed for a year, it gives you a sense of security, because without it, you could be dismissed for no reason and not offered severance pay. if you have a contract and they decide to negate it, a lot of times they will give you severance pay, kind of as I always thought of it as a guard against lawsuits. So there are, however, 3 difficult clauses in contracts. These are usually found in medical practices and are especially difficult for nurse practitioners to interpret, even though they might have a big effect on their life. These clauses address restrictive covenants, bonus formulas, and termination clauses. These clauses can bring nurse practitioners to attorneys for advice. So the first one is the restrictive covenant. Have you ever heard of that, Martha?
Yes.
That's where you promise not to compete, and it might be written in the contract that you're restricted from practicing within a certain set of miles from the business for a certain period of time after you would leave the employer's business. Because what can happen is if you are disgruntled, for example, with an employer, you can actually, I think it's illegal, but you can take the names of their patrons with you. And so you can set up one block down the street and begin your practice with your prior employer's patrons.
Yes.
So this is sometimes written in the contract to keep people from doing that, because if you decide to go ahead with it, then you can be sued if it was in the contract and you agreed to it. They are legal in many states and enforceable as long as they're reasonable. I think your book talks about what's considered reasonable and what's not, and usually it's the judge that determines that. For example, if there aren't many healthcare providers in a certain area, and your employer decides that you can't practice once you leave them, then the judge may decide that based upon the hardship or likelihood of injury to the public that lives in that community, that restrictive covenant is not reasonable. And so he would throw it out and allow that person to practice. So it's kind of interesting. I'm sure there are a lot of lawsuits, at least your book alludes to the possibilities for the restrictive covenants. It's to cut down, you cannot do it solely to cut down competition. And if the judge figures out that's what you're doing it for, you know, it's all about you, then they won't uphold the covenant if they find that it's unreasonable. So it's the balance of the employer's need for protection and your need to have a job. So it's kind of an interesting idea. Martha, where you work, are there bonus formulas?
Yes.
And we're going to talk a minute about the different kinds, and you can tell me in a minute what yours is. But for nurse practitioners, there's what's called a productivity-based formula, and this would be the number of patient visits per year. And this is good if the majority of your patients are fee-for-service system reimbursement, because then you're getting money every time they come in. So the downside of that would be if you just brought people back all the time just to get money from them. Bonus formulas make less sense if the numbers of patient visits are based on a practice that is capitated, because the goal here is to have as few visits as possible. So if you're bringing them in right and left, and your job actually is to keep them out, then that's not going to work for your business. But the employers have to be careful that you are not withholding care just to keep the number of visits down to make yourself look good. So with all of these bonus formulas, there are ethical dilemmas. If you overdo it, you're going to be in trouble. So whatever the formula is, it should fit the practice payer's mix of patients. There's also quality-based formulas, and this is good whenever the patients are covered by things like managed care plans. So you're awarded based on meeting or exceeding quality standards set by the health plan. So if, for example, emergency department visits declined in the past year, then if that was one of the quality standards you were looking for, then you might get a bonus based on the reduction every year of the number of patients that go up to the hospital. In this situation, it's good that you have your own panel of patients so that you're responsible just for that group and you're only held accountable for that group. Then there's profit-based formulas where some employers share profits. And, you know, it's either gross or net income that you would be measuring, and that can make a difference between a bonus or no bonus. So if you agree to this, then you should have the right to audit the financial records. And you should also negotiate for how you're going to resolve disputes if some come up with the formula. There's patient satisfaction-based formulas, and this is a little bit controversial because that's very subjective and could be, I guess, tampered with. So what kind of bonus do you have?
It's when you exceed, it's productivity based.
Oh, okay. Okay. That's pretty straightforward and easy to track. So are you in a fee-for-service place?
Yes.
So that would fit you where you are. That would work. So how often do they give the bonus for productivity?
Once a year.
Once a year. That's good. That's good. It encourages you to take on more, which I guess is good as long as safety is still in your mind.
Yes.
Right? There is termination without cause. Normally, the termination section of an agreement will list events that are the basis for termination with cause, and that would be conviction of a felony or loss of a license or hospital and gross negligence. And some employment agreements include a termination without cause clause, hard to say, with 30 days notice. And that really defeats the purpose of the contract in the first place. So you might, ask for that clause to be deleted unless you give up the right to leave within a 30 days notice. So watch for the termination clause without cause. That's virtually not having a contract. It's a little tricky, the contracts. Most people that are going to work for somebody will have their attorney read the contract. It's a good time to get an attorney on the front end rather than on the tail end. So how should you negotiate a reasonable agreement? Well, if you want to, get a raise or have some productivity or something in your contract, then you need to come to the table, negotiation table, explaining what you've contributed to the practice in the past year and actually have data. Most administrators like numbers, so you'll want to have numbers to prove that you, for example, for you, Martha, it would be that you've seen more patients than you did last year. Of course, if you're a brand new practitioner, that's kind of hard to do because you haven't had a chance to build a record. So you should contrast the revenue brought in with the expenses that go out related to your own practice. And they should be able to tell you that, what that is. New nurse practitioners should begin to collect data, and most of the time you don't think of that as a brand new nurse practitioner. You should ask yourself about how many patients can I see and how much physician consultation will I need. The physician consultation, you'll probably need a lot when you're a brand new practitioner, and as you get more experience, you'll need less and less. But on that front end, you're actually costing the office, so a lot of times they will, you will have to pay that some way, somehow. Secondly, you should know how the practice gets its revenues. How is that broken down? But if you want to negotiate, you gather this data. What's the most frequently billed CPT code for this practice? That's a procedure code. So if you don't know how to do something like an incision and drainage, and that's the most frequently billed code, you might want to, be educated on that so that you can do that and get income for your clinic. What percentage of practice income goes to cover practice expenses? What is the collection rate for the practice? How much money do they actually get? You can charge a lot, but that doesn't mean that's going to come in. Decide what terms of employment are essential to you and which can be given up. What's the give and take that you're willing to do? And what drawbacks will the employer raise in negotiations, and prepare to defend or minimize their drawbacks. They're going to have some counter arguments for you, and you need to try to be ready for them. Basically, it's best to negotiate as one person rather than a member of the group, unless the employer has a standard thing. All nurse practitioners that come in, they get $50 an hour. Then it's good to go with a group and say, all of us don't want to get $50 an hour. So all things, remember, are negotiable. If you do not ask, you will not get. So to get a lawyer to review your contract before you sign it, generally you can expect to pay around $400, and that's a reasonable amount. To negotiate your salary, there's 4 methods of payment that are currently being used to pay nurse practitioners. There's straight, There's straight salary, which is paid a set amount to perform according to your job description. There's a percentage of net receipts. These are where you're paid the amounts in MP bills minus the accounts receivable minus the nurse practitioner's portion of practice expenses. Then there's a base salary plus a percentage that you're guaranteed a set salary but can make additional salary if they generate practice income. And Martha, that's what you were talking about, that you get a bonus for productivity. And then there are nurse practitioners that are paid for the hours that they work at an hourly rate. Projecting salary for a nurse practitioner. If you had your own business, how would you calculate their income? Well, you base it on their billings. So you subtract 10% for unpaid bills. That's people are not going to pay. You subtract the calculated figure for practice expenses, which usually is 20 to 50% of the earnings. The cost that it takes to consult a physician, which is 10 to 20% of the earnings, and the percentage of employer profit. So the average salary for nurse practitioners is somewhere between $90,000 and $102,000. a year. And of course, that depends on the area that you're located in. 3 things to remember when negotiating. One who does not ask will not receive. One who does not deserve will not receive. And even when one asks and deserves, one will need to do some selling to get what one wants. You have to sell yourself, and that's not something most people are able or willing to do. So you have to ask the following questions. What benefits are usually offered here? Do you pay for continuing education? What about when I'm away for continuing education? Do I still earn my salary? What do you do to help people retire? If you have a health plan, do you include vision and dental, which some do and some don't? And if calling is required, will you furnish me something so that I can do that? And then vacation time and sick time, do they pay the malpractice insurance? And if they do, what kind of policy do they have? Then you can ask, you're going to relocate me? The problem with relocation, I got relocation expenses one time. Bad news. Good news, I got relocation expenses. Bad news, they reported to the Internal Revenue Service and I had to pay it as income. So beware. It'll come back around. You'll see it again. You'll have to pay income tax on it. So is there a sign-on bonus? A lot of places have sign-on bonuses. I guess that's based on how much need they have for whatever you're doing. Our expenses of the travel for the interview page, that might be the case if you were going to another state. I don't think that's the case if you're driving down the street. Does the employer pay for professional dues? Most of them won't, but if you don't ask again, it won't happen. Do they pay for books and subscriptions? This would benefit them, but whether they would be willing to do that or not, I don't know. But the librarian, if there is one where you're working, you could check in with them and see if they would be willing to order those the next subscription year. What about tuition reimbursement benefits for nurse practitioners? I'm right now enjoying those from my employer, and I always had a feeling that was something I should try to use if I could. So is there short and long-term disability insurance benefits? I can tell you that when you get 65 years of age, you will get a letter from the government that says, you're too old to claim disability insurance benefits, so don't try at 65 and older. If travel to various sites is necessary, will they reimburse your automobile expenses? And this is definitely something that's usually done. So again, negotiating your work environment. A lot of nurse practitioners have to or can volunteer to be paid extra for on-call time, but you need to know how are you going to reach somebody if you have a question or need the doctor in the states that it's required that you have a collaborative agreement. And what kind and how many staff support will there be? What will they do for the nurse practitioner? Who does the nurse practitioner report to about medical issues? And what kind of methods do you use to gauge quality? If the nurse practitioner finds an aspect of the organization that she would like to change, how does she go about doing that? And is she expected to build a panel of patients or cover for overbookings of the other providers? So hopefully those will give you some ideas for when you go to interview or look for other jobs and you're thinking about what should go in my contract. You can have some negotiation with some of those items. But when you're going for a job, you want to be an employee of an employer, then these are the questions. Why should I hire you? How many patients are you used to seeing? What's your productivity capabilities? Do you have a DEA number in case some of your patients need substances? How independent are you going to practice? What do you actually bring to the practice, and what's your greatest strengths and weakness? What do you see yourself doing in 5 years? That's a very common question. And does working evenings and or weekends bother you? So those are some questions you need to be ready to answer whenever you go on an interview. So the responsibilities of an employee, that actually you're supposed to add goodwill, promote your practice wherever you are to the public, practice, using current standards of care, and if there's any trade secrets, then you're supposed to protect them, like mailing lists. Don't be carting those out. So that probably is a HIPAA violation and can get you in really big trouble. Provide a good customer service to the patient. Remain unimpaired. Don't do drugs and alcohol while you're on the job. And then keep your credentials and continuing education, all the requirements of the State Board of Nursing up. And always, don't violate HIPAA. Ask on the front end about the expectations. What are they expecting with productivity, quality, and other performance measures? And if there aren't those measures in place, then volunteer to develop some for them. The best policy for malpractice is occurrence policy, and we've said this more than one time in this course. Should be at least $1 million per claim and $3 million aggregate, which covers the expense of an attorney. With malpractice insurance, they do not represent you. You have to find your own attorney, and they will help you pay for the attorney's services. But they will not, if you call them up and say, I'm in trouble and I need you to represent me, that is not what they do. Collaborative practice agreements. If you're setting up your own office, know that I think in almost every state they have to be approved by the Board of Nursing or Board of Medicine, or both, before you begin your office practice. And in some places there would be qualifications and limitations on the collaborating physician. So is it mainly for prescriptive authority or for any form of advanced practice? And will there be hospital inpatient care, suturing, surgical assistance, prescription of controlled substances, nursing home practice? What does the collaborative agreement as an employee look like, and what do you want it to look like if this is your office? So you need to see if their area of specialty matches the MPs. So if you had 5 MPs in your office working for you, and one was a psychiatric nurse practitioner and she was seeing patients, well, a family physician, it doesn't really qualify to be her preceptor because the area of specialty doesn't match. And I know that happens all the time, but it shouldn't. Check out the physician's record. You don't want somebody that's been sued for malpractice, many times and almost lost their license, but barely was able to hang on to it. So once you get it formulated, then you submit it to the Board of Nursing. Martha, do you have any questions for me?
No.
We're moving along in this course, aren't we? We're getting close to the end. How are you coming along with your business plan?
It's coming along.
It's coming along.
My question is, are we going to put the pieces together that we've been writing, or we have to rewrite the whole thing?
You need to have it as a single document. So
But
hopefully,
we can incorporate the same parts that we've been.
It's the whole idea is that as you go through the course, you're actually building the document in parts, in parcels, so that at the end you put all of what you worked toward in your document, your one document. You put all those pieces together that you've been accumulating as you go through the course.
So it's just a matter of linking them in a logical way, right?
Correct. You're going to help it flow, but what content is you shouldn't be getting new content for what you've already written. You've got feedback on it if it needed to be changed or you needed to write more. So if everything's been going along smooth, then you've got, up until right now, you've got a good portion, should have a good portion of the document already done because you've done it along the way. That's the whole idea is you're actually building it. You're not having to start all over and write this huge document. You're doing it in pieces along the way as we cover stuff. So yeah, that should make the last, assignment a whole lot easier for you all.
Okay.
Any other questions? Because if you have them, I'm sure your peers do too if they listen to these tapes.